I'm Nicole. I'm going to be your nurse today. I'm just going to wash my hands before we get started. I'm going to close the curtain for privacy. Can I see your wristband? Can you verify your name and birthday for me?
Alyssa Lametta, 12196.
And do you know where we are right now?
University of Detroit, Mercy.
And do you know the date?
It is April 5th.
Okay, patient is ANO times 3. And she appears her age. She has no present signs of illness. She looks clean. There's no odor. Her speech is clear, and her mood and affect are appropriate and pleasant. Okay, so I'm just going to start with your head. I'm going to feel through your hair. No bumps or lesions. Her hair is clean and evenly distributed. Now I'm going to move on to your face. Temperature is warm, skin is smooth, no cuts, lesions, bruises. Her nose is midline, lips are symmetrical. Can you close your eyes and tell me where I'm touching your face?
Cheek, forehead, chin, cheek.
Okay, very good. And can you puff out your cheeks? Raise your eyebrows, smile. Okay, cranial nerves 5 and 7 are intact. I'm going to move on to your eyes. Just look behind me. Okay, pupils are reactive, round and even and symmetrical. Conjunctiva is pink, sclera is white. And then I'm just going to have you follow my pen. Okay, good. Now I'm going to move on to your mouth. You can open your mouth. Okay, no lesions, edema, bleeding in the gums. Teeth are white. Lips are smooth and no lesions or bumps. Say ah.
Ah.
Tonsils are grade 1. Uvula has mobility and uvula is midline. The tongue is moist, no lesions or bumps or anything. Okay, so now I'm going to move on to your neck. I'm going to feel your carotid arteries. Okay, now I'm going to listen and hold your breath when you feel my stethoscope. Okay, no signs of bruise, and I'm going to have you lean back a little bit and look side to side. Okay, no evidence of jugular distension. Now I'm going to move on to your heart, and I'm going to listen. In the second intercostal space on the right is aortic. On the left, it's pulmonic, and then in the third intercostal space on the left is the Erb's point, and then fourth is tricuspid, and then midclavicular, and the fifth intercostal space is mitral. And I'll listen for 60 seconds there to get apical pulse. I'm going to switch to my bell. Okay, no signs of murmurs and S1 and S2 sounds are present. Now I'm going to listen to your lungs. Just take a deep breath. Okay, now I'm gonna move to your back. Just keep taking those deep breaths. Okay, and then I'm gonna have you lift your arms. Okay, lung sounds were clear. And tell me if you feel any tenderness.
Nope.
How about here?
No.
Okay, and I'm gonna have you lean forward a little bit. Spine is straight and midline, no curvature or protruding vertebrae. And now I'm going to move on to your upper, or first, diameter is 2-to-1 ratio. Now I'm gonna move on to your upper arms. Okay. Temperature is even on both sides. Skin is even and appropriate for ethnicity. No cuts, bumps, or bruising. I'm going to test your capillary refill. Less than 3 seconds. And then I'm going to have you squeeze my fingers. Okay. And then I'm going to listen to your radial pulse, or feel your radial pulse. Equal and bilateral and grade 2. And then I'm going to listen to your brachial. Your feel. Okay, equal and bilateral and grade +2. And now I'm going to move on to your legs. Temperature is warm and even on both sides, and no bumps or bruises, no lesions, skin's even tone, and I'm going to feel your popliteal pulse. Even and bilateral on both sides and grade +2. I'm going to feel your tibial. Even and bilateral and grade +2. And now your dorsalis pedis pulse. Even and bilateral on both sides and grade +2. And I'm going to test your Babinski reflex. Normal reflex. Okay. And now I'm going to have you stand for 20 seconds. And close your eyes. Okay, 20 seconds. And then you can have a seat. And then I'm going to have you stand up again, walk to the wall, and then walk back and sit down. Okay, gait is steady. And then I'm going to have you lay down, and we're going to go to your abdomen. Okay, I'm going to listen, auscultate, starting in the right lower quadrant. And in the right lower quadrant, there is the right ovary and the cecum. In the upper right quadrant, there is the liver and the right kidney. In the left upper quadrant, there is the stomach and the spleen. And then in the lower left quadrant, there is the left ovary and the sigmoid colon. Okay, vowel sounds were heard in all 4 quadrants. Now I'm going to percuss. Tympanic sounds, except over the liver, is more dull. And now I'm going to palpate and tell me if you feel any tenderness. Okay. And then you can sit up. And the abdomen was flat and even in contour. Okay, and you're all good.